Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the radial nerve. The radial nerve is the largest nerve of the brachial plexus, and this is the brachial plexus. It is the larger terminal branch of the posterior cord of the brachial plexus. The brachial plexus has three cords: lateral cord, medial cord, and posterior cord. And the posterior cord has two terminal branches. The larger one is the radial nerve. The smaller terminal branch is the axillary nerve. The radial nerve receives fiber from C5 to T1. It innervates all muscles of the posterior compartment of the arm and forearm. It provides sensory innervation to the skin of the posterior and inferolateral arm, posterior forearm and dorsum of the hand, lateral to the axial line of fourth digit. There is some overlap on the dorsal cutaneous innervation of the radial nerve. And radial nerve also provide articular innervation to the shoulder joint, to the elbow joint, and the wrist joint. Idea is that according to the Hilton's law, if a nerve passes over the joint, that nerve innervates that joint. Okay, so we'll go to the course of the radial nerve. Okay, so the radial nerve exits the axilla posterior to the axillary artery, passes posterior to the humerus. This is the humerus. So the nerve is passing behind the humerus in the spiral groove or radial groove with profunda brachii artery, or you can call it deep artery of the arm, passes between the lateral and medial head of the triceps brachii muscle. The medial head get innervation in the axilla. Other two head get innervation in the spiral groove area. Perfores the lateral, it passes through the spiral groove, then it perfores the lateral intermuscular septum at the level of the lateral epicondyle of the humerus. The radial nerve diverges into superficial and the deep branch. The deep branch passes through the supinator muscle, and superficial branch provide the digital innervation on the dorsum of the hand. This is the deep branch that passes within the supinator muscle. Superficial branch is this. It will provide the digital branches. In the spiral groove area, we also get the posterior antebrachial cutaneous nerve. We also get the lower posterior cutaneous nerve of the arm around the spiral groove. So we have two cutaneous nerve here, one cutaneous nerve here. So we got the muscular branches to the back of the arm. This is the dorsal aspect of the forearm. In the hand, there is no muscle that is innervated by the radial nerve. Radial nerve does not supply the muscles of the hand. So we got the radial nerve, muscular branches, motor branches. Okay. We have the brachialis muscle, triceps brachii, and coneus, very small muscle close to the elbow joint, the back. Brachioradialis, extensor carpi radialis longus, and brevis. We have the deep branch or terminal branch, and after it passing through the supinator, its name changes into posterior interosseous nerve that is motor to these muscles like supinator, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, extensor pollicis brevis and longus, extensor hallucis, abductor pollicis longus. Okay, these are the muscular branches. These are motor. We have sensory innervation, articular branches to the radial nerve. We just discussed according to Hilton's law. It innervates the shoulder joint. It also innervates the elbow joint and the wrist joint. We have the posterior brachial cutaneous nerve that comes out of the radial nerve at the radial groove area, and inferior lateral brachial cutaneous nerve that also comes out of the radial nerve in the radial groove. There is the posterior antebrachial cutaneous nerve and inferior lateral brachial cutaneous nerve that is for the lower part of the back of the arm. This is for the back of the forearm. We have some superficial branches, dorsal digital nerve, that is cutaneous nerve, and we have some ulnar communicating branches from the dorsal digital branch. We'll get these are the communications. We'll go to the radial nerve injury. Radial nerve commonly injured by fracture of the mid shaft of the humerus. Idea is that at the mid shaft of the humerus we have the radial groove, and radial groove contains the radial nerve and the arteria profunda brachii or deep artery of the arm. So as because there is fracture, there may be fracture in the mid shaft of the humerus, so radial nerve may be injured. Saturday night palsy, not necessarily Saturday night, any night it may happen. Sleeping in an armchair with hanging the upper limb by the side. If it is continued for several hours, certainly the radial nerve will be maybe compressed. That will lead to the Saturday night palsy. So muscle will not work because of the nerve palsy. That is the nerve compression. It is maybe Saturday, it may be any other day. Pressure by a crutch is also possible. There will be loss of extension of the wrist. We call it wrist drop, like this. Okay, that may be damage to the fracture of the mid shaft of the humerus involving the radial nerve. Or wrist drop may also happen in some type of occupation many years back, like painters. Lead is present in the paint, was present in the lead was present in the paint in those days, and that lead was toxic to the nerve, especially it damaged the myelination of the nerve. So one of the features of lead exposure or lead-based paint exposure, especially the painter, they have the wrist drop. This person cannot extend the wrist because all the muscles are either paralyzed or the nerve may be damaged. And that's all about the anatomy of the radial nerve. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice day. Bye now.